few more minutes for question and answer, or if you want to stay a few minutes, it's fine. I'm going to finish here now. And Sri, you might be take me off from your spotlight view so people can come to your gallery view. If they ask any question, or if they have any question, I cannot read it from here. So if you can read it for me, I'll be able to gladly answer.
So I have removed the spotlight.
Okay. Yes.
That was a wonderful, mesmerizing session, Dilip ji. Really nice. There are a few questions. Let me just read it from the chat box.
Okay.
The first one is, provide the name of the chair with the wheels once again, the one that you had, the chair.
These days, you need only one name. It's called Amazon.com. You've heard of Amazon.com? It's a type called a kneeling chair. Knee, like a kneeling chair.
Okay, not the kneeling chair. Okay.
Kneeling chair, and it comes in all different forms. I have it for years and years. This may be my fourth one. And this is actually in front of my computer.
Okay.
The hunchback is the number one disease what we have. Yeah, Amazon.com, kneeling chair.
Okay. The next, Dilip Thatte wants to know what pranayam would you recommend for addressing pulmonary fibrosis?
Actually, pulmonary fibrosis, what we do, that remember, when you have a problem in breathing, you develop a fear, panic, and anxiety. So we really don't recommend to start with any of your pranayama practice. What we do is start relaxation response first. Start relaxing your respiratory muscles. Do the shoulder, it is called the Skandha Chalanasana. Do your Brahma Mudra. Do your Paschim Namaskar. When you're able to do that, remember in pulmonary fibrosis, you are not into exchanging. So what you do, you breathe out first, then you take a deep breath in, breathe out a little longer time, then slowly and slowly you incorporate what is called a breath holding in inhalation, breath holding in exhalation. It is called a Savitri pranayama. But remember, don't try to do a pranayama first if you have a respiratory problem. The reason is, when you have an Annamaya kosha, I have a problem in my lung, fibrosis asthma, it affects my pranamaya kosha. I cannot breathe properly. When I cannot breathe properly, it affects my mind, manomaya kosha. I'm anxious, I'm panicky. I'm not going to do the breathing if you tell me. So I need to prepare my physical body first. Then in the typical Savitri pranayama, what we do, first, take a slowly deep breath in. This is called Puroka. Then you hold your breath. It is called Abhantarin Kumbha. Hold it as long as you can without any effort. Please don't make any effort. To make an effort, it is not a therapeutic pranayama. Then you exhale out. It's called Rechak. Then you hold your breath again in Rechak. People ask me how long, what number, 4 second in, 8 second hold, 8 second out, 4 second. Those numbers are arbitrary numbers. It varies from person to person. But my way approach to you is that totally effortless ease practice. As long as you can do the practice with your talking, breathing, and when you learn how to do this, your breath holding in inhalation, Abhantarin Kumbha, in Abhantarin Kumbha, you incorporate Jalandhar Bandha. It is called a Murcha Pranayama. A Murcha Pranayama is a wonderful practice for pulmonary fibrosis. It even puts your totally mind quiets down, fear goes away. Let me show you one technique, a Murcha Pranayama. First, you breathe out first. Take a deep breath in. Hold your breath. And keep your neck straight. Slowly drop your chin down. Touch your chin close to your chest. And you stay here. Keep counting as long as you can stay here. Remember Murcha. Murcha is called unconscious. Keep doing it. But again, please prepare your physical body first before you get into a pranayama practice.
Thank you very much.
Welcome. Call me. I need to talk to you. Okay.
The next one is, I think you answered it, but how long and how many cycles we should do pranayama?
Actually, again, like for us, we say we do a daily practice, 25 minutes of asanas, 25 minutes of pranayamas, 10 minutes of meditation. That is my and our usual practice. Asanas, we rotate the asanas, but pranayama, we do fixed pranayama. We do a start with the Bastrika, we'll do, and then Kapalbhati, then Anulom Vilom pranayam, then we do a Brahmari pranayam, Ujjayi pranayam, then you do little, another called Shankha pranayam. Shankha pranayam is a resisting exhalation. It's wonderful. You do it's called Adhimudra, put on in the top. You breathe out first. Remember, you do not use your mouth. Say, always breathe through your nostril. If you breathe through your mouth, you don't know where the air has gone in. But you can use your mouth to use like a for Sitali pranayam, cooling down, or blow it out like the Shankha pranayam. Breathe out first. Take a deep breath in through your nostril and breathe out. So we do a set of pranayama, but I say people say do it 5 minutes, 10 minutes. I say start with your body will allow. At the beginning, you may do 30 seconds, 1 minute. Why? It happened to all of us. We could not do anything. I was a surgeon, I was operating, bending over. I had a serious back pain, neck pain, could not breathe, I could do everything done. So 25 minutes asanas, 25 minutes pranayamas, 10 minutes of meditation is a very good practice for daily.
Can I ask you a question?
Sure.
Just one thing, there's a few more things in the chat box. And I just want to mention that all this thing is getting recorded, so you don't need to just jot down exactly what he's talking about.
I have time. If you guys have a time, I'll be glad to answer because I like to connect with all of you.
Sure.
We have some session going on next.
There are a few other questions. One is about ear issues. So ear infection, do you recommend any kind of pranayam that's good for ear pain or ear infection?
Ear pain, actually for the ear and tinnitus, we call it a Karnarogantar pranayam. Karnarogantar pranayam, we call it your Valsalva. So basically, we have an ear connected through your eustachian tube, opens the mouth. So blockage in the eustachian tube is one of the root cause for the miliar infection and ear infection. So what we'll be doing, we'll be breathing out first, taking a deep breath in, and trying to blow out with closing our nostril and mouth.
Oh yeah,
and you will see both the eustachian tube will open up. Or you can do a swallow. And you do it all the time when you're in the plane, when the plane is trying to land. Your ear gets blocked because there's a tube connecting from the ear comes to your mouth. It's called a eustachian tube. Take a look at it, Google it. You'll see all of them. So you open up. The pranayama is called the Karnarogantar pranayama. Karna is a ear. Rogantur means treatment, it's a pranayama. And in Western medicine, we call it a Valsalva maneuver.
Dada, can I ask a question?
Sure. Yes, sure, go ahead.
During our gold nugget process, we breathe out and hold the breath for 40 seconds. But I cannot go more than 25 seconds. I cannot hold the breath out for more than 25 seconds.
You didn't hear me the whole session? What the whole session I was talking to you?
Yeah.
Huh? What whole session I was talking to you? Listen to your body. Why do you have to hold 25 seconds?
Okay.
Hold for 5 seconds. What your body will allow you today, do it. But if you keep on doing it, this is called a neuroplasticity. You will get into 5, 10 seconds, 15 seconds. One day you'll see you'll be able to hold it for as long as you want. Do not put in a time frame. Do not compete against anybody. You do, even in my class, I don't know if you might have seen, I tell everybody, do it with your eyes closed. So you don't see even who is doing what. When you do eyes closed, yoga is a introspection. looking inside yourself. We said, exercise is a workout. Yoga is a work in. So listen to your body's signal. Don't fight against you to do a practice.
Does it indicate that your lung capacity, or it is a processing the carbon monoxide?
It doesn't indicate anything. It indicates that you are not listening to your body. It indicates a lot of things physiologically. But what it indicates that you are in a state that you listening to your body's signal. I can do this much. Yes, more carbon dioxide. We have explanation for everything. We are scientists, we are physicians. But our only explanation and guide to you is that introspection, self-realization, listening to your body, listening to your soul, and progress accordingly.
Thank you.
Welcome.
Can I have one question, please?
Sure.
I have a diabetes type 1. What kind of pranayama can help?
Okay. First of all, you got a diabetes, the type 1. Type 1 diabetes in yoga talks about imbalance in your physical body. You do all the balancing asanas. Balancing asanas followed by, if you want to do a pranayama, you do alternate nostril breathing, Anulom Vilom pranayama. And then finally, what you need to do is, remember, diabetes today, if you know this there, he knows that if you put a person a little bit of prednisone, the blood sugar goes up. Prednisone is called a steroid. Steroid increases the blood sugar. And the hormone of stress is called cortisol. The stress increases the blood sugar. But massaging the pancreas, Kapalbhati pranayama. We do Kapalbhati pranayama and we do what is called your Prithvi mudra. Prithvi mudra is touching your ring finger and thumb. It really stabilizes your obesity, truncal obesity, and the most important cause of diabetes is called truncal obesity. So you sit down in a Prithvi mudra, close your eyes, very gently and slowly do Kapalbhati pranayama. To do alternate nostril breathing, Anulom Vilom pranayama, but before that we do all the balancing asanas.
So one thing I wanted to mention, the question that who asked Nayan, he has excellent headstand. Okay, so he does balance the other way.
See the headstand. So see, people all ask me about headstand. Okay, so think about a headstand. You don't do a headstand. Okay, so so even for your teachers, how to learn a headstand. Headstand is the most relaxing asana. If you look at yoga practitioner, say, who can you say? Say Iyengar. One thing, let me tell you. All our present day yoga gurus or practitioners, if you look at, say your Krishnamacharya tradition, Iyengar lived up to 96. His student Pattabhai Joyce lived up to 93. Student Indira Devi lived up to 102. So we have a train, So what you do is sit down in a Vajrasana. Why Vajrasana? Vajrasana is the most relaxing asanas. So then what you do, this is your stance, you put it here, clasp your hand, put your head down, and you feel miserable. Your head is all flush, cannot talk, you cannot breathe. But one thing is that don't let anybody touch you. One thing very important in yoga therapy is that don't do any adjustment. You can show it to them. This is the way you do Vajrasana. They cannot do it today. They can put a little, a folded blanket, pillow, slowly and slowly they can remove. So you are sitting here. Slowly and slowly your breath will normalize this. When your breath is normal, flushing is gone, you get up. When you keep on walking, you will see your body goes higher. So you don't have to do anything. Body goes higher, Come down. But don't let anybody touch you. Keep doing it. What will happen by the time you keep on doing it and keep on walking here, your body is going to go high up. Slowly and slowly is going to go high up. Again goes high up, come down. See, this is the art of yoga therapy. Art of yoga therapy is not to push yourself, listening to your body's signal and progress accordingly.
Can you
No,
I used to do Shirshasana in my 50s. I'm now 80. Is it okay at 80 to try Shirshasana?
why not?
I'm just asking the question.
I'm just asking you. Why are you asking me?
No,
You know whom,
I'm
you know,
asking
you know whom do you need to ask?
Yeah.
The doctor within you. You have a doctor inside you. Huh?
Yes.
Don't
yes.
ask a doctor. Ask
Okay.
what you need. You put your head down. See how you feel.
Okay.
You feel miserable with your head down. Don't do it. Your
Okay.
doctor is saying that you are not ready.
about the
Same
Okay,
thing.
there is
What is the neck?
neck might
You
hurt,
know, I tell you one thing.
twist your neck or something,
Oh, you'll break your neck, so don't do it.
according
I can tell you
to
one thing. I can tell you one thing. If you do in stages, 80 years, 90 years, my father-in-law, he's 97. He does every day. My mother-in-law, actually, they were 84, she's about 86. They teaches yoga even at this age. Every day they're doing it. Any asanas, they can do it.
Can we do
Because your neck pain is not your spinal stenosis, or it is your irritation of a nerve, tightness of the muscle. And headstand is the most relaxing. You know what? If your body is not ready,
Don't do
body
it.
is not going to allow you to a headstand.
Don't do it.
No, it's very important. Very important of a yoga therapy standpoint is that listening to your body, don't listen to anybody else.
Thank you.
according to
Very
the
good to go into it again.
Try that and let me know in a month. You'll be able to
Yes.
do it.
can we
Yes,
do
I will. Thank
Eight
you.
is
one
a
question.
Can I ask a question?
number.
Yeah. Okay. Okay. My question is that I normally have clogged nose, because of deviated septum. So I have a problem doing pranayam to start with, and stuff like lom anulom. So how do I proceed? Because I cannot do it completely to start with, and because I don't do it, it doesn't get better. What do you suggest? How should I address it?
First of all, in our morning practice, we do every single day Jalneti. You wake up in the morning, I drink a glass of water, I have a first bowel movement, I brush my teeth, scrape my tongue, I do Jalneti. I took a little powder, and Jalneti is a daily routine. You wash your face, wash your eyes, wash your everything. And this is the most important organ which you are breathing. Deviated septum has nothing to do. Once you do a Jalneti, if you put a Jalneti, first of all, no water will come out because you are very tight. You are really not letting once relaxation sets in, you'll see when you blow it out, you'll see all the junk and dirt comes out. When you go to India, when I go to India, I do that, literally the black carbon comes out. Then what you do after that practice, you do a little bit of a Kapalabhati pranayama first. Sit down. I do different posture. Put your head down. Then you close one nostril into Kapalabhati pranayama. See, your one nostril is open. To the other nostril and then to Kapalabhati pranayama. See, both are equal. Now you try on your nose. See, your one side will be less open than the other. But once you're practicing it, then you do the relaxation. See, my both nostril is equally open. Then you'll be able to do alternate nostril breathing. And it's a comforting. Only thing you need to know, it is a slow process. It's not going to take overnight. So you have to keep working on it and listening to your body's signal.
So Jayant, go ahead, if you want to ask a question.
Yeah, Sriji, I have a question after.
Sure.
Um, Hello, I am actually like a 25-year-old male, and I came over to US for my master's degree. I completed my master's degree, just started my job, and I was diagnosed with multiple sclerosis. Um, I have lost vision in my right eye, and after an MRI of my brain, neck, and spine, they told like I have some lesions or white spots. So basically, my nerve endings has a bilirubin fat which is being scraped off by my own immune system. So it's an autoimmune disease. I'm trying to do some yoga from the last 4 to 5 days, but I'm not able to take up very strong ones. Like I cannot do the headstand or any, you know, or any type of yoga that is really um, is very strenuous because I have this weakness and fatigue factor also kicking in. So do you recommend any specific yoga, Guruji?
Sure. First of all, you remember multiple sclerosis, you're losing the covering of your nerve. It's like,
Yeah.
you have electric cable. It has a coating. The
Yeah.
nerve coatings are gone, and it is primarily called an autoimmune disease. Like our body is fighting against. Autoimmune called is an imbalance of your immune system. Your immune system. So you bring all the balancing poses. And remember, yoga as a therapy is a relaxation response, is an activation of parasympathetic tone. It is not doing any strenuous, not doing the headstand, not doing your Mayurasana. It will all come to you. You practice a very slowly graded balancing asanas. Try to standing on one foot. Do your hands, do your Gomukhasana. And anytime you use your both side of your hand and then do the pranayama, very slow, methodical pranayama. And remember one thing, the whole yoga therapy practice is called your anti-aging. The whole multiple sclerosis is a basically your body is acting up, eating up because of imbalance. And yoga therapy brings the balance back in your body and mind. You can go to my website or you can go to my YouTube channel. Sri, you can share my YouTube channel. Go to Dilip Sarkar Yoga and share with all of your people. And I have all the yoga therapy for all the neurodegenerative disorders, multiple sclerosis, diabetes, every disease you have, I have the videos over there. And I have one video which is called Yoga Therapy for, this is the one. I have the book. The book I wrote is called Yoga Therapy, Ayurveda and Western Medicine, A Healthy Convergence. You can get my book. The book has all you have a DVD. It's called Yoga Therapy for Health and Healing.
Okay.
So do not force yourself. Listen to your body and do a daily practice. You will overcome it. You will overcome what you have.
Jagdish, you have a question?
Yeah. Can I go?
Yeah.
Sure.
Oh, okay. Yeah.
After
Dilip
that, I
ji-
have a question, Sriji.
Okay. So go ahead, Jagdish.
Okay. Yeah. Dr. Sarkar, thank you for the wonderful session. I have attended one of your sessions at the Sri Vishnu temple 3 years ago. And I had that book also. So anyway, quick question is two questions. One is about acid reflux. So I've been taking acid reflux medication for like about 8 years. So I really actually want to get off it. So which are the asanas and which are the pranayams are specifically will helpful? And the second one is about Sirsasana. I can do a really good Sirsasana, but because of the acid reflux, should I avoid doing it at a certain time or after eating certain food? Can you be specific about it?
So you guys are like a Western people thinking, staying in America, become Western. You want all the shortcuts. I want to do a shortcut for acid reflux or the shortcut. Acid reflux is basically you are producing more acids because your mind is hyperactive. Your software is working too hard. So do all the coming cooling practices. And if you want to specifically go is to the Sitali Pranayam. Sitali Pranayam, Sitkari Pranayam, and acid reflux is also called a Pitta disorder. And you do the asanas is called a belly centered. Any asanas which is centered to your belly, and also do your abdomen relaxing asanas. Kapalbhati Pranayama, you can do a Mandukasana. Mandukasana is a wonderful asana. You sit down in a Vajrasana. With a Vajrasana, you put your hand there, pushing, and then keep coming down, keep the head down. Vajrasana, Shashankasana. Then you do your, we call it a Pet Naram, Shir Thanda, Maro Daktar Ko Danda. समझा हाँ मेरा हिंदी तो बहुत अच्छा हिंदी है I cannot speak Hindi but pet nara your abdomen has to be softer, so that is the way you call it your Udyani Bandh, Agnisar Kriya. And regarding headstand, people all ask me, I have a neck pain, I have a head pain, my doctor has another thing, very important thing. If you really want to do a headstand, if you want to do it in privately, especially in our age, and don't talk to your doctor. Because your doctor has no understanding, and doctor will scare the hell out of you. And I tell you one very beautiful example. There's a lady, she was practicing. She was in my class. She got really got my, into. Her husband told her not to. She said, why? He said, their health insurance premium will go high up. So coming back for the acid reflux, you do a Sitali Pranayama. And all the asanas to do your Pet Naram.
Thank you. Excellent. Yeah. Very, very specific. Thank you.
Ravi,
But daily practice. Remember, only way you will get out of any disease is a daily practice. No shortcut.
go ahead.
Can I
Ravi.
ask you a question, Sriji?
Ravi ji is first, and then after that you can ask Bula.
Sure.
So, Dr. Sir, my question is regarding hypertension. I'm taking about 6 medication just for blood pressure. So, is there something specifically you can recommend
I think,
to bring it down?
Yeah, today we strongly believe that hypertension, unless there's a cause, is your own creation. You have created your hypertension. And primarily the hypertension causes the tightness of the blood vessels. It's called a peripheral resistance, and a relaxation response, and a pranayama, a very relaxing pranayama, and incorporating your daily lifestyle. See, a simple yogic lifestyle. Wake up in the morning between 4 to 6. We call it a Brahma Muhurtu. Sit down in a squatting pose, drink a glass of water, have a bowel movement. We do a brushing out teeth, scrape out tongue, gel neti, do a little late breakfast, in yoga, main meal is a lunch. If you go to India, you see the yogis, lunchtime, what they eat? They eat a little bit of khichdi. The problem people ask me about diet, what diet? You know what the biggest problem with us is diet? We eat too much. Main meal has to be lunch. Then you do a little bit of afternoon, go to our bed a little early before going to bed, drink a glass of water, have a good night's sleep. You will see your blood pressure will start to come down. Alternate nostril breathing, Anulom Vilom Pranayam, is the therapy for hypertension. And the relaxation response is called a reduction in the afterload. The physicians here, they will understand. It reduces called peripheral resistance. So for hypertension, what I will do, I'll be doing all very gentle relaxing your hands, relaxing your Paschim Namaskar, relaxing your neck, relaxing your back muscles, and do a fine, very slow alternate nostril breathing. But these are in addition to your daily practice. If you keep on doing just specific few things for one disease, what I have seen in my practice, your disease gets worse because your mind, I'm not getting anything. Oh, I'm doing Kapalbhati Pranayama, my blood sugar is going higher. You're not doing it too fast, too rapidly. You are not listening to your body signal. I like to
Thank you.
listen to Bula. I see Bula's one. Bula Ghosh.
Bula,
Bula.
go ahead, Bula.
Where is Bula?
Hi.
Can you put the video on? Yeah, okay.
Yes.
Yeah,
Yes.
all right.
Minister,
Here I
how
see
are
her.
you?
Kemun
You
acho?
know,
Kemun
yeah.
acho?
Yeah, you are the one who introduced me to this yoga class from Rajnarayan class, then Sriji, you know. I've been following all of you. So here is my question. In short, I have TKR, which is, total knee replacement. And I always get scared of sitting you said Malmutra? That one,
Malasan.
Malasan. So is there any alternative to of this to your book or something, somewhere?
It's not, you see, knee joint replacement, hip joint replacement, these are all, you have a scar tissue, tightness. So I have people in my class with a knee joint. I have one of Mrs. Kamalis Kapoor, she sits down. So what you do, you have if you cannot sit down here, you come down, sit wherever you can.
Yes.
You stay here.
Okay.
Chair,
Okay.
get a chair at hand, you sit down here, stay here. Then you get another lower one. You get a lower one, you come down slowly, more come down. In stages, you will see slowly and slowly you come down. So we really have no restriction for you. You practice without taking any pain medication.
Right.
And you practice not go up to the pain. If you stay behind your pain, and if you go in stages, like I have, this knee joint is more swollen than this. I have a lot of changes, but nothing, this is.
Just gradually you go.
Gradually you do it, and
yeah.
And a total knee joint, total hip joint does not restrict us from any kind of yoga process if you're listening to your body's signal and you're doing it without taking any pain medication.
Yeah, I don't take the pain medication, And the way I handle this one, like you said, copper glass, I've been drinking water early in the morning in the copper glass, I try to do it, and it's been a year. But the way I handle this particular asana, I take that water when I am on the commode. Just sorry,
That's okay.
Is that okay? Or
yeah, this is okay, but but remember one thing: the whole yoga practice is let go.
Let go.
The whole yoga practice is that I want to do it. You will never able to do it.
Okay.
Only way you'll be able to do it. You said, you know what? That's it. I don't want it. You listen to your body, and this is basically called, Sri knows very well. It is called let go phenomena. The moment you start let go, everything happens to your body and mind. The moment you want something, remember in our scriptures, the nishkam karma. Your karma has to be nishkam. The moment you have a desire, the moment you have an outcome, everything falls apart. No outcome, no desire.
Thank you so much. It's a wonderful session. Thank you.
Answer suno, Sri. Let's finish with the old call. Karo yog, raho nirog. Huh?
Okay.
Karo yog, raho nirog. Okay? Everything okay?
Yes.
Anything else is waiting? Anything?
One last question.
Okay.
According to the ophthalmologist, head standing is not good for your eye pressure. Is it?
Where do you talk to your ophthalmologist?
I don't want to name it, but
yes.
Why do you talk to your ophthalmologist? You know who you need to talk to? Your own doctor. Did you talk to your own doctor? You put your head down. See how you feel. You feel your eyes are throbbing, eyes are bursting. Don't do it.
Don't do it.
No, I keep doing it. I do it all the time. But
so listen to the doctor inside you. If your doctor inside you says, I'm a Western trained doctor, I can tell you. Western trained doctor works with only one principle and phenomena. It is called a fear factor. It will scare the hell out of you. So you keep coming back to them. listening to your body, listening to your body's signal, you have the whole healing power, and you will heal by yourself.
Thank you.
Thank you.
Thank you.
Wonderful statement.
Very nice session.
Excellent.
It-
Excellent.
Thank
That was that's
Thank
very
you.
wonderful session, Dilip ji, and really appreciate you spending time with us. And we'll certainly.
Where does he stay? Where does he live?
You know, I tell you one thing, the most important thing what I've done for you and what I do for everybody, I'm not scripted, and I'm doing it from my own personal experience. I do it every single day. I'm sharing my practice, and I'm sharing based on what you are exchanging with me.
So which town you are in, sir?
He's in Virginia.
In Virginia. Okay.
Norfolk, Virginia, not too far from you guys, you know.
Okay, not far. Yeah.
My son and daughter lives in DC, so I come there all the time. After pandemic, Sri might have a session, will to come to a session for you.
Good.
Is there
And
a
then
way
put us in the home, you know.
Dr. Dilip,
Age is not a factor at all. You know, remember one thing. You know, it's your mental age. It's not your physical, it's not chronological age. I've seen people, you know, you have seen people in 50s that already looks like 80s and 90s, and then people in 90s, 97. Can you, only thing is he cannot hear much, and he tells me, you know, it is so blessings for me. I don't have to listen to all these problems in the world. I'm fine, you know. Wonderful life, you know.
Can I ask one question?
Yeah, go ahead.
I broke my my arm, and I had a surgery and inserted a metal piece here, and I feel my bolts and nuts here and there, and but I have a pain, not here. I have a pain. Metal pieces here, but I have a pain here. And when I consulted my surgeon, and he said if even removing this metal piece doesn't relate with your pain there, so well, you can avoid another surgery if you just leave the metal piece. But when I talked with the acupuncturist, he said without removing the metal piece, we can treat you. So I'm just stuck. Can I ask your
Sure. Best way to do it, you try to find a position where it hurts. Okay, this is causing pain, so you cause less short of pain, and then in that position you do alternate nostril breathing. So when you do alternate nostril breathing, it brings the balance back, and you will see by the time you close your eyes to alternate nostril breathing, your hands will go back here, and you will never know hand has gone there. It's a wonderful practice. You try this. You know, this area it hurts, go short of it. Close your eyes, do alternate nostril breathing, and just pay attention to your breath. Don't pay attention here. I have so many times people have a frozen shoulder. So I said, go to Bhastrika Pranayama. Oh, I cannot raise my arm. It's okay. Close your eyes, do it with one hand. When they close it with the one hand, suddenly the other hand goes there. Because your mind goes into your breathing, and that is called your koshas, Annamaya kosha to Pranamaya kosha. When you pay attention to your breath, your physical body goes up without knowing.
Yeah.
It's a wonderful practice.
Just wanted to mention that the person that asked the question, Kate, 1 year ago, she didn't know anything about yoga. She's during COVID, she started attending classes, and now she's a certified yoga teacher, and she has excellent classes.
Beautiful. But ask her to incorporate the pranayama and asana together for therapeutic purposes.
Thank you very much.
Welcome.
All the credit goes to Sri. Thank you very much.
Thank you.
All this.
Thank you.
Yes, he has.
That was great.
I can,
Thank you.
you know, I'm talking. I don't know I'm talking. I'm effortless, so I can continue for a whole day.
Dr. Sarkar, is there a way to connect with you on the phone in person for
No.
some serious physical conditions?
I think, you heard me, what I'm saying, and you do it yourself. Yeah, you can always talk to me, but not and that is not going to help you. What will help you?
Yes, Dilip Parikh, just
What will
please
help
mute
you
yourself.
is listening to your body and do a very gentle practice.
Right.
Don't push yourself.
Yeah. Yeah.
Dr. Sarkar, I have a
Thank you.
question. Some people tend to sleep with their mouth open. You said it's always good to breathe through the nose rather than
Generally, what you do in yoga practice, what you say when you have a mouth open, that means your nostrils are blocked, And in yoga, it says when you put a oleation in the nostril, your nose opens up, you don't have mouth breathing. Mouth breathing is dangerous. Mouth breathing is a sign of your sleep apnea, a sign of your snoring. So what I do, or what we do before going to bed, take a little oil. And we use in a very private practice, you do on a little finger, we put the oil inside our nostril, oleate everything. Because at night, what happens is the dryness, the mucus dries up and your nostril gets blocked. We say we sleep through our nose, not through our mouth. I don't know, I'm from Bengal. In Bengal, we say one word, Bula might hear it, called nak tel diye ghumai. You sleep, we sleep with the oil in your nose. So oiling the nose is a better. Bula nake tel diye ghumai. শুনেছো?
হ্যাঁ শুনেছি
সেই জন্য নাকে তেল দিয়ে ঘুমায়।
আর ওয়ান মোর আর একটা কথা বলছি আমার যে ডাক্তার প্রাইমারি কেয়ার ফিজিশিয়ান 44 years old she always advised me to do yoga twice a day maybe your student I don't know
I think a lot of physicians are now realizing that this effect of this relaxation response has a profound effect on our chronic diseases, chronic lifestyle related diseases.
Yeah, it's all good. I mean, I really love my doctor.
No. You have to love your own doctor. You have to love your own doctor.
Oh yes, that is the first one. This one is second one. Thank you. Good seeing you.
That's it now. Okay. We'll socialize next time we come together. Sri, if you want to have this.
Thank you very much, Dilip, and I'm going to end the meeting.
Thank you, Dr. Sarkar.
Thank you.
Thank you so much.
So let's do it again.
Thank you so much. Very nice. Very nice.
Meditation. All right.
Thank you.
Bye.
Thank you.
Thank you.
Thank you very much. Thank you very much.
Yeah, excellent session.
Thank you, Dr. Sarkar. Thank you very much. Thank you.
Take care, Ramesh.
Thank you, sir. Thank you.
Thank you, sir, also.
I have been your student for 25 years now.
Shrikant, wonderful.
I am my student for all my life,
Starting with Life in Yoga Foundation, we are still connected.
Sure.
All right. Thank you, sir. Bye-bye.
I can't thank Sri Guruji enough. Thank you, Guruji.
Sri, thank you.
Thank you, Shri.
Everybody stand up without any support.
Yes, get up without a support.
Yes.
Good. Wonderful.
I did it. Thanks, sir, for bringing such a wonderful program. Thank you.
Welcome, Savita. Namaste.
Thank you. Thank you, Guruji.
Thank you.
Hi, namaste. Hello, Preeti. Namaste.
Thank you, Shri. Very nice program. Thank you, Sarkar ji. बहुत अच्छा किया आपने. Yeah, so many questions has been sorry. I have one question for you, if you don't mind.
Go ahead.
Is there any suggestions for you for patients who is having RA problems?
Very simple. Relaxation. Everything comes from the tightness to the relaxation practices. Don't push yourself to relaxation asanas.
Thank you.
Welcome.
Dr. Sarkar, I have one question.
Yes.
So you spoke about yogis not wearing reading glasses, right? So though I got my very minor reading number about 5 years ago, and I tried to kind of maintain it for a couple of years. And I started my yogic practices mainly with the pranayam and light warm up about 5 years ago. But I still have reading glasses. It's not going away.
It will never go away because your mind wants to get the glasses away. That's why you're wearing glasses, you know. Nishkam karma. Do the tratak and eye movement. Take your eyes, take a look at the eyes, do the eye exercises.
I do
called
that.
Tratak. Do a tratak daily, you'll see a lot of improvement in the eye.
Yeah, I do the rolling of the eyes, and I take my right thumb in front of me, and but I don't do tratak in true sense, like, you know, looking at the jyoti or something. So,
but keep doing it. But only thing you need to do, get your mind out of the way that I don't need the glasses, you know, because that is driving you to the point. Like, I don't wear any glasses, you know. But for me, yes, if I wear a little glass, I see better. Okay. But I can leave.
नहीं, मेरा नंबर बढ़ते जा रहा है, इसलिए मैं पूछ रही हूँ कि नंबर every year it goes up. I also know little bit of acupressure for the eyes, और वो जो तुम्हारे eyes के side में जो nerves है ना, उसको थोड़ा stimulate करो, muscles को, वो सब करती हूँ, लेकिन नंबर कहीं नहीं जा रहा.
Number will go higher because you want it. Let go. Let go, keep doing it, let go, it will happen to you, you know, it will happen to you.
But you know, in a once a year when you do the eye exam, you feel that it must have at least controlled it, like same number रहेगा, ऊपर नहीं जाएगा, but वो ऊपर जाता रहता है. So I was like, that question came up.
धीरे-धीरे it will go up more, you know.
Achha, I have one more question. I think you spoke about therapeutic yoga today. Somehow I feel that Ayurvedic massages and some of the Ayurvedic treatments, they are also yogic sciences, you know. So how can we integrate these yogic science, I mean the Ayurvedic medication with the allopathy, which is highly important right now to get rid of the acute symptoms?
It's very simple. See, Ayurveda and yoga have the same root. It came from Veda. Yoga therapy is Ayurveda. Yoga therapy is Ayurveda, and we incorporate every Ayurvedic principle. Next time we'll do it called Ayurvedic yoga therapy. You'll see, you all talk about Ayurveda because you are in the United States. If you're in India, nobody talks about Ayurveda, nobody talks about yoga. It's all same root, same philosophy, same practice. It just somebody wants to give it a different name. And Ayurveda is not those pills, that known herbs. Ayurveda is a philosophy. It's a bhakti and kaf, you know, it's your doshas, you know, it's your gunas. So it's your jatar agni, it's your prana, it's your nadis. So these are all part of yoga.
Yeah, but you know, people from India only, they are so much into allopathy, like mainly because allopathy works on the symptoms. It doesn't work on the causal, like the cause of the disease. So they are rushing for the allopathy. And when we say that you should also do Ayurveda, even the Ayurvedic doctors say that you don't go for allopathy, but allopathy can, it has a faster solution for the symptoms. People tend to go towards allopathy and then they skip Ayurveda. So what message we should give to such people that we can integrate both the medications together?
You have a very simple message. If you go to India today, you will see that people have failed in all the chronic diseases. So allopathic doctors takes Ayurvedic medication and Ayurvedic doctor takes your allopathic medication. Remember, pill is not the answer. Answer is your mind. This is your software. If your software fixes your hardware, software releases all the medication. I'm here sitting, I don't take a single pill. I'm healthy. So they want a shortcut. They don't want to do a daily practice. And this is so classic if you go to India, because I go to India so often, I see all this. All the allopathic physicians are taking Ayurvedic medication and Ayurvedic taking allopathic medication.
No, and they are good with the yogic practices, like all this yoga, pranayam, they are good. But when it comes to Ayurvedic massages and, you know, Ayurvedic treatment, which is for a chronic disease, like, you know, we just spoke about MS. So there are some Ayurvedic, Ayurveda says that we can cure the MS from the causal, like if from the root, but allopathy says we can only control it, we can manage it. And there is no cure in the allopathy for MS. So what do I tell such patients and their parents that, hey, you can try Ayurveda while you are working on allopathy?
Why do you want to listen to anybody? Well, tell them, listen to your body, practice. Do your practice, listen to your body, and you will see the outcome. It's as simple as it is. You talk to different people, they're going to all push their ideas, Your idea is here.
No, that's correct.
Yoga is a work in, it's not a work out. Whole Western concept is work out.
I mean, your doctor is within you, that's correct. But what happens is when it comes to your own blood and flesh, your own family member, you want to listen to the the knowledgeable, like
Sangeeta, I think, I don't know how long we should continue with this topic.
Okay, we'll continue another time, okay?
Maybe I'll just call you.
Another time. Okay, thank you.
Yeah. Thank you, Dr. Sarkar. Excellent session.
Sure, finish it now.
Okay.
Thank you, Dr. Sarkar. It was very nice. Thank you.
Thank you very much.
To end the meeting now. Thank you very much, everyone.